Have you ever noticed yourself or a loved one asking, "Could you repeat that please?" more often than before? It's time to listen closely. Hearing loss affects millions worldwide, but the good news is there are solutions. Today's video is crucial as we will be diving into the world of hearing loss. Hearing is an essential part of how we connect with the world, and losing it can have profound effects on daily life. We are going to break down everything you need to know, from causes to prevention, treatment options, and living with hearing loss. Hi everyone, welcome back to our channel. Understanding hearing loss, causes, symptoms, and solutions. What is hearing loss? Hearing loss is the partial or total inability to hear sounds in one or both ears. It can range from mild to difficulty hearing to complete deafness. Hearing loss occurs when there is a problem with one or more parts of the ear. But did you know there are three main types of hearing loss? Main types of hearing loss. First, conductive hearing loss. Conductive hearing loss occurs when sound is not effectively conducted through the outer ear canal to the eardrum and the middle ear. This type of hearing loss typically affects the ability to hear softer sounds and can be temporary or permanent depending on the underlying cause. Causes: ear infections. Otitis media, middle ear infection, can cause fluid buildup leading to the blockage in sound transmission. Earwax buildup. Excessive earwax sediment can block the ear canal, preventing sound from reaching the eardrum. Fluid in the middle ear, often a result of allergies, cold, sinus infections, which can lead to fluid accumulation behind the eardrum. Eardrum perforation, a tear or a hole in the eardrum can disrupt sound transmission. Ossicular chain disorders. Issues with the small bones in the middle ear ossicles such as osteoclarosis or dislocated bones can impede sound conduction. Structural abnormalities. Abnormalities or deformities in the ear structure can prevent proper sound transmission. Symptoms: muffled hearing or reduced hearing ability, particularly for low frequency sounds. A sensation of fullness or pressure in the ear. Possible ear pain or discomfort, especially if caused by an infection. Treatment. Medical treatment. Addressing infections with antibiotics or treating underlying conditions causing fluid buildup. Earwax removal. Professional cleaning to remove blockages in the ear canal. Surgical interventions. Procedures to repair structural abnormalities or fix the ossicular chain may be necessary. Sensory neural hearing loss occurs due to damage in the inner ear, cochlea, or the auditory nerve pathways. This type of hearing loss affects the ability to hear higher frequency sounds and is often permanent. Causes: aging, presbycusis, natural age-related deterioration of the hair cells in the cochlea or the auditory nerve. Noise exposure. Prolonged or intense exposure to loud noises can damage the hair cells in the cochlea. Genetic factors. Hereditary conditions that can cause gradual or sudden hearing loss. Ototoxic medications. Certain drugs such as some antibiotics and chemotherapy agents can be toxic to the hearing structures. Diseases. Conditions like Meniere's disease, acoustic neuroma, or viral infection affecting the inner ear can lead to sensory neural hearing loss. Symptoms: difficulty hearing high frequency sounds such as consonants in speech, trouble understanding speech, particularly in noisy environments. Gradual loss of hearing over time, often starting with higher frequencies. Treatment: hearing aids, devices that amplify sound and improve hearing clarity. Modern hearing aids often include advanced features like digital signal processing and noise reduction. Cochlear implants, electronic devices that provide a sense of sound to individuals with severe sensory neural hearing loss by directly stimulating the auditory nerve. Auditory rehabilitation therapy to help individuals adapt to hearing aids and improve communication skills. Third, mixed hearing loss. Mixed hearing loss is a combination of conductive and sensory neural hearing loss, where both outer or middle ear and the inner ear issues are present. This type of hearing loss involves both impaired sound conduction and damaged sensory cells or nerves. Causes: combination of factors. Mixed hearing loss can result from overlapping issues affecting different parts of the ear. For instance, an individual might have both age-related sensory neural hearing loss and an ear infection causing conductive hearing loss. Accidents or trauma. Physical injuries to the ear that damage both the middle ear structures and the inner ear can result in mixed hearing loss. Symptoms: exhibit symptoms of both conductive and sensory neural hearing loss, including muffled hearing and difficulty understanding speech. Symptoms may fluctuate depending on the underlying causes affecting the different parts of the ear. Treatment: comprehensive approach. Treatment involves addressing both conductive and sensory neural components. This often requires a combination of medical treatments, hearing aids, and possibly surgical interventions. Hearing aids used to amplify sound and address the sensory neural aspect. Medical and surgical treatments, addressing any conductive issues through medications or surgery to treat infections, remove blockages, or repair structural problems. Hearing rehabilitation, therapy and support to help adapt to hearing aids and improve communication strategies. Next, let's talk about the degrees of hearing loss. Hearing loss is characterized by its severity, which determines the challenges someone might face in daily life. There are 4 main degrees. Mild hearing loss. What it means? You can hear, but softer sounds are hard to catch. Example, imagine you're at a restaurant and you're chatting with your friend. You can hear them, but when the waiter comes over, the background noise makes it hard for you to understand what they are saying. Impact: you might have trouble hearing in noisy places or if someone is speaking softly. Conversation in quiet environments are usually fine, but background noise can make it harder. Hearing range: people with mild hearing loss struggle to hear sounds quieter than 25 to 40 decibel. For example, a ticking clock or rustling leaves might be hard to detect. Moderate hearing loss. What it means? Louder sounds are clear, but regular conversations become difficult to follow without extra effort. Example, you're on a phone with a friend, but you keep asking them to repeat what they are saying, even in a quiet room. Or maybe you're watching TV and everyone tells you you've turned the volume too high. Impact: you often need to ask people to repeat themselves, and you may find yourself relying more on watching people's lips or body language to understand what they are saying. Hearing range. You have difficulty hearing sounds quieter than 40 to 70 dB. This would include normal conversations, birds chirping, or the hum of a refrigerator. Severe hearing loss. What it means? You can only hear very loud sounds, and even then, understanding speech without help. Example, if someone across the room is talking to you, you won't be able to hear them unless they are really loud. You might only hear bits and pieces of speech or loud noises like traffic or vacuum cleaning. In fact, conversations without hearing aids or other support become nearly impossible. Even loud sounds like someone shouting might seem muffled. Hearing range. People with severe hearing loss can't hear sounds softer than 70 to 90 dB. This includes sounds like a vacuum cleaner around 70 dB or a busy city street 80 dB. Profound hearing loss. What it means? Only very loud sounds can be heard, and those are unclear. Example, you're standing right next to a fire alarm, but it sounds faint. You can't hear most everyday noises like people talking, music, or cars honking. You may rely completely on lip reading or sign language to communicate. Impact. Without powerful hearing aids or cochlear implants, communication is extremely difficult. Even with these, you may need additional support to understand speech. Hearing range. Sounds quieter than 90 dB are nearly impossible to hear. This would include everything from a blender around 88 dB to a loud concert 100 dB. Stay tuned for part 2 of this video, where we uncover the causes, symptoms, impact, and explore treatment options to help you tackle your hearing issues.